ancestres.
We recognize the loss of languages due to slavery and the fact that today many of us do not speak the language of our ancestors.
La justicia lingüística está enraizada en una historia de resistencia por comunidades y pueblos cuyas voces han sido silenciadas por generaciones. Y practicar la justicia del lenguaje es enfocarnos en la descolonización y en un enfoque sanador al idioma.
Language justice is rooted in a history of resistance by communities and peoples whose voices have been silenced for generations. And to practice language justice is to focus on decolonization and a healing approach to language.
Practicar la justicia del lenguaje es responsabilidad de todos. Como tal, te pedimos que hagas tu parte hablando lenta y claramente, teniendo en cuenta que el español es 30% más largo que el inglés.
Practicing language justice is everyone's responsibility. As such, we ask that you do your part by speaking slowly and clearly, keeping in mind that Spanish is 30% longer than English.
Si nos escuchas en español, puede que te sorprenda escuchar algunas palabras terminando en una E, que usualmente terminan en A o en O. Esto no es un error, sino parte de nuestro compromiso al uso del lenguaje inclusivo y practicar la justicia de género.
If you're on the Spanish line, you might be surprised to hear some words ending in an E that usually end in an A or an O. This is not a mistake. It's part of our commitment to inclusive language and practicing gender justice.
Para practicar la justicia del lenguaje esta noche vamos a usar la función de interpretación de Zoom. Una vez se prenda la función de interpretación, va a aparecer un globo en la parte inferior de tu pantalla que dice Interpretation o Interpretación. Haces clic en ese globo y de ahí seleccionas tu idioma, el inglés o español, y entonces puedes poner en silencio el audio original.
We'll be practicing language justice through the Zoom interpretation feature. Once the feature is turned on, you will see a small globe appear at the toolbar at the bottom of your screen that says interpretation. You will be able to choose your language, either Spanish or English, and you will also have the choice of silencing the original audio.
Le pedimos a todos que si no son total y completamente bilingües, seleccionen un canal, incluyéndole facilitadores.
If you are not fully bilingual, please select the language channel. Facilitators, that goes for you too.
Si te estás uniendo a nosotros de un teléfono celular o tableta, no vas a ver ese icono apareciendo en la parte inferior de tu pantalla. En vez, una vez prendida la función, en el menú desplegable que está en los tres puntitos que dicen More o Más, va a aparecer la opción de Language Interpretation o interpretación de idiomas. Haces clic en esa opción, seleccionas tu idioma, puedes poner en silencio el audio original y entonces debes apretar Done o Finalizar para asegurarte que estés en el canal correcto. Cualquier duda o pregunta la puedes hacer por el chat. Gracias.
If you're joining us on a cell phone or a tablet, you will not see this icon appear. Instead, you will click on the three dots that say More, select Language Interpretation from the drop-down menu, then choose your language, and then you must click Done to make sure that you are in the right room. I'm going to turn on the interpretation now, and you can ask us any questions in the chat.
Okay, interpretation is now open, everybody. So I'm gonna pass it to Sonia Hernandez to start our conversation.
Hi everybody, good evening everyone. Sorry that I'm joining from my phone, but my internet today is not working with me. But we are so excited that we are having this fireside chat where we're gonna have, the hospital, talk about the hospital debt and the financial aid assistance. So my name is Sonia Hernandez, and I am a community organizer at Make the Road, Connecticut. And today we're gonna have, the intent of this discussion is to moderate the panel of health advocates with everybody who serve clients and patients um, who who are uninsured and economically dispersed. Together we will, dialogue and conversations and educate our community and members of the community about curricular opportunities, how to take advantage of financial assistance policies. We know there is so many programs, but we don't know what financial assistance are there for us as a members of the community. So this event is being conducted by Health Equally for the people, by the people, and Health Equally for the people coalitions of Connecticut based on organizations working to make healthcare more affordable by organizing our community of Black, Brown, and immigrant communities to fight to increase access to affordable health insurance for low-income families and residents, all, and regardless their immigration status. So the coalition is made by three organizations, where is Health Equity Solution, Ministerial Health Fellowship, and Make the Road, Connecticut. So where during these discussions, everyone will be mute to reduce the background, and also we can, not hear noise or this interruptions to hear better the panelists that will talk to us. So this will be a opportunity to interactions. You will have the time, to raise your hands or put it on the chat. That we're gonna take questions. But also we ask you for each of you that are joining us today that please mute yourself. And we're gonna try to use, the emojis for you can, raise your hands, but also you can put the questions on the chat. And please, we ask you to be patient as we call, several people when they are raising their hands. Or if we don't have the chance to answer all the questions, we want to hear from everybody's voice and hear from each of you concerns or questions that you have. If we cannot answer right away, please, you can put it on the chat, and we gonna, try to accommodate and answer all the questions to the entire conversations. So once again, so I want to, welcome everybody and thank you for being here with us. And also please put it on the chat if you're not hearing the interpretations or you're having trouble hearing well. So now I would like to introduce, our moderators or our panelists. It will be Catherine Villeda. She is the police director of Health Equity Solutions. And also we have our panelist, Jenny Chan, that she is the projector manager of the community catalyze. So we are so excited to have them with us. So I will pass it to Catherine. And thank you everybody and welcome.
Thank you, Sonia. Hi, everyone. Next slide, please. So I'm really excited to be having this fireside chat today, especially during Health Equity Week. In Connecticut, the first week of April is considered Health Equity Week, and this week annually reaffirms Connecticut's commitment to eliminating inequities in health and ensuring all residents can achieve optimal health. So this year's theme is around affording equity because times are tough, and many Connecticut residents cannot afford what they need to stay healthy. Some have huge medical bills, which we have heard several stories about throughout the legislative session this year, while others worry about not having a stable home to live in and many are stressed about paying off their student loans, especially after student loan forgiveness was taken away or canceled, however we want to frame it. Affording equity reminds us how important it is to tackle these problems so everyone can have a fair chance to access what they need for a good and healthy life, including for the 280,000 Connecticut residents who have medical debt, which will be the primary focus of today's chat. So next slide, please. So for today, it is our goal that all of you will be able to walk away with a clear understanding of what your rights are to protect yourself against medical debt or how to fight back when you get an unexpected bill from the doctor. I'm very excited to be joined here today by Jenny Chang, who works at Community Catalyst, a national health advocacy organization where they provide advocacy support to state, local, and tribal advocacy organization and partners and community organizing partners on a variety of issues, including medical debt. Jenny will be going over a toolkit that Community Catalyst put together, made up of 6 guides, and is currently available in English and in Spanish on their website. I do want to take a quick moment to just name ahead of time that we will have an opportunity for a Q&A at the very end. And while we understand that many of us are experiencing medical debt or have loved ones dealing with medical debt, we don't have the capacity to answer any specific personal questions here. We're very invested in making sure that everyone has access to the tools that are available and see how you might be able to apply them in your personal situation. But we did want to just clarify that we are not professionals in answering very personal questions. So with that being said, I'm going to throw it over to Jenny so that she can share with us more about the guides.
Great, thanks, Kathy. Hi everyone, my name is Jenny. I just put the link in the chat to the guide. You can find the PDF version in English and Spanish. And I'm gonna share my slides. Do you mind, Katya, taking down the screen? Okay, so as Kathy mentioned, Community Catalyst put together a guide on medical bills. We did this in partnership with an organization called US PIRG. So US PIRG is one of our partner organizations, also does very similar work in the health equity justice space. And I believe we're both national organizations that work throughout the country, different states. So why was this written? It was written because we all know that medical bills are very confusing. I mean, I'm sure everybody in here has gotten a medical bill they don't understand. I definitely have. And sometimes it can feel like you're alone trying to figure out these bills. And this guide is to help people navigate the billing process and understand their rights. So you'll see here, the guide is broken down into 6 different questions. So people can find tips for their specific situations. And there's information for people with insurance, who are uninsured, or just paying cash for whatever reason. And people have different rights kind of depending on if they have emergency care or if they have scheduled care, for example. So this guide will give a brief overview. It's a very big guide, as you'll probably see if you clicked on the link in the chat. So I'll give an overview of some of the sections, but the full version is definitely available to everybody. And I believe the slides that I have here will be made available to folks too. So the first part of the guide talks about if you have insurance and need emergency care. So when you need emergency care, you can't really tell the ambulance like, oh, I want to go to this hospital. They'll bring you to usually the closest hospital. And sometimes that emergency room may not be in your network if you have insurance. So what was recently passed federally is called the No Surprises Act, which protects you from surprise medical bills. So basically, if you go to that emergency room and the doctor ends up not being in your network, you will not be charged any more than you would pay for an in-network care. So these protections also apply to air ambulances. So if you need to get a flight to the nearest hospital by air ambulance, you'll also be protected from those surprise medical bills from the ambulance company. But the protections do not apply to ground ambulances, unfortunately. So the No Surprises Act does not cover ground ambulances, but some states have been leading the way and doing extra protections so that people don't get these surprise bills from ground ambulances too. So you'll see in this image that 14 states have passed protections so far. Washington State also recently passed protections for ground ambulances. I don't believe Connecticut has these protections yet, but maybe something soon. And another important note too is that the No Surprises Act does not cover urgent care centers. So even if it's an emergency situation, you will not be protected from the No Surprises Act. So the second part of the guide is for folks who have insurance, need to schedule care. So it will go through a couple different things such as being billed out network, getting surprise medical bills, facility fees, for example. And it does a pretty good job, I would say, breaking down the different terms that we often see, like premiums, deductibles, copays. And it defines them in pretty plain language about that, so that most people can understand when they get these bills. So for instance, a copay is usually the set amount that your health insurance requires you to pay for appointments or services. And we have these in Spanish as well. So the guide does give pretty good tips, I would say, about what to ask. So when you're going for a visit at a hospital, people often ask, do you take my insurance? And that might actually get you a different answer than you might expect. So the doctor may say, sure, I'll take your insurance. But then what they're saying is that they will accept it, but they might not be in your network. So you might end up with a higher copay, or you might end up with a higher co-insurance that you did not expect. So what's a better question to ask is, are you part of my insurance network? That makes it clear that you're asking them if they are in network so that you aren't charged out of network prices. What's important to note too is that we've heard that some providers do push people to sign what's called a surprise billing protection form. So this is a waiver that some providers will ask you to sign, basically saying that they can charge you out of network prices. So these providers listed on here cannot ask you to sign this waiver. It's actually illegal. So for example, like I mentioned with the emergency room, if you're in there for emergency care, that doctor cannot ask you to sign a waiver saying that you will pay out network prices. So the third section is for folks who are uninsured and need to schedule hospital care. It also is applicable to people who are insured but choose not to use their insurance to pay for their care. So you'll find some tips about how to ask for a good faith estimate, which I'll go over shortly. What to do if you're denied an estimate, and what to do if the estimate is greater than what you expected. We do suggest that folks who are unsure about their rights with a medical bill, they can get in contact with a legal aid organization in the area. The Attorney General's office of the state is usually also a good advocate for folks. they can typically, the Attorney General's office has resources to help people navigate different consumer rights, such as medical bills. So there's what providers need to provide now is called a good faith estimate. So basically, before you get a service, you can ask, or they're supposed to provide, without asking, an estimate for the cost of your care. And under the No Surprises Act, if the bill is $400 or more over the good faith estimate, you can actually challenge that. And how you do that is through something called a patient provider dispute resolution. So this is actually part of the federal government agency called CMS, Center for Medicaid Services, I believe. So what they do is they have a third party get involved and be able to mediate and be able to negotiate for you to make sure that you're not paying much larger than you should be paying because you received the estimate before getting that service. So the website is actually available in both English and Spanish. So people can submit for a dispute resolution in Spanish too. You can also submit a complaint if this happens to you. So if you get a good faith estimate and the actual bill is $400 or more over, you can submit a complaint to the Consumer Financial Protection Bureau, or CFPB. So basically it informs them that this hospital is not in compliance and will submit a formal complaint so that the agency can investigate and make sure that this does not happen to anybody else. Again, this is actually available in both English and Spanish, and these investigations are completely confidential, so you can submit the information without submitting your name or any other personable identifiable information. The guide also does provide some info on what to do if at the end of the patient provided dispute resolution, it's still unaffordable. So you can do things such as apply for financial assistance. There's an amazing organization called $4 that actually helps people navigate the financial assistance process. They'll help you apply, and they have people who can walk you through the process. A lot of legal aid organizations also do something similar. So if there's a legal aid organization near you, that's also a good resource. What folks can also do is they can ask the hospital for a no interest or affordable repayment plan if you do not qualify for financial assistance. So usually you're able to usually negotiate with the hospital about what is something that you can reasonably pay, and hopefully it does not have interest. What we advise is that you do not sign up for medical credit cards or medical loans. Usually these are kind of predatory, so they can say no interest or deferred interest. And we've heard stories about people who sign up for these cards and don't really know the terms and end up with that is a lot higher than they should have paid. So there are some consumer protections on credit cards too. So if you pay your medical bill with your credit card, your personal credit card, you actually don't get the same protections as you would if you pay the hospital directly, right? So it's hard for the hospital to determine, what exactly you paid for with your credit card, if it's because it's not coded as a different expense. It's coded as just a personal expense, right? So it's hard for for instance, to remove from your credit report because the credit bureau does not know, is that bill for medical bills. It does not differentiate between that and, your rent, for example. So this is just another example of a good faith estimate. Usually they'll provide, hopefully in a written form. So this is an example that I believe was sent to US PERG, where somebody was quoted a certain price and the actual price of the service was $7,000 more. So what they were able to do is go through the dispute resolution process, and be able to get the quote completely down to the estimated price. So some a little short quiz. So about knowing your rights. So when you're at a doctor's office and you want to know if they take your insurance, what should you ask? Do you take my insurance plan, or are you in network with my insurance plan? Yep, some same folks say the bottom one, are you in network? Yeah, so again, you would want to ask specifically, are you in network? Because they can say that they take your insurance, but still bill you out of network. So you pay much higher prices than you would for in network. It's just another activity. So this one is, let's say you go to a doctor and they give you a good faith estimate for a broken arm for $500, but a few weeks later the bill comes and it's $1,000. So what should you do? Should you get a lawyer? Should you pay a bill? Should you ask the provider to adjust it, file complaints, just sign up for a credit card to pay for it, or use the patient provider dispute tool? Yeah, seeing folks say the patient provider dispute resolution tool, yeah. So you definitely don't want to just get a lawyer right away. I mean, that's probably an extra expense on top of your medical bill. You don't want to pay the bill because if you pay the bill, it's going to be a lot harder to get your money back. And you don't want to sign up for a medical credit card because that is just another form of debt for you. So you can ask your provider to adjust the bill, without going through the dispute process first. Let's say that you tell your doctor, hey, you said that you were going to charge me $500, and they agree verbally and adjust the price, then there's no need to go through the process, right? If they don't adjust it and they're pretty adamant saying that you have to pay the higher price, you can file complaints, you can use the patient provided dispute resolution tool, and those steps will definitely get you hopefully the lower price. And if not, there's different tips in the guide as well about what other steps you can take. So the fourth section, this is if you receive the medical bill that you cannot afford to pay. So a lot of times what we see is there's different billing errors or denied claims, just some mistakes that are human error. So it's very important to definitely look through your bills, understand the different terms so that you can advocate for yourself. What you can also do is you can ask about financial assistance or ask about zero or low interest payment plans. Typically hospitals, they don't they don't offer this upfront, so people usually have to ask, unfortunately. But if you do ask, they should be able to provide you some resources and help direct you about who to talk to. So this section also provides how insured patients can fight illegal out-of-network surprise bills. So if you get a illegal surprise bill, you want to notify your insurance plan. If your insurance plan does not resolve the situation for you, you can contact the provider who sent you the bill and tell them that this is a surprise medical bill and you know that you're covered under the No Surprises Act. If the provider still demands payment, as I said before, you can file complaints. You can also call the No Surprises Help Desk, which is a part of the CMS agency. That's the agency that also provides the dispute resolution tool. And definitely an important step is to check your credit report, because some hospitals do unfortunately send bills to collections even if they're not supposed to, or even if you're trying to negotiate with them or in the process of applying for financial assistance, they should not be sending your bill to collections. So that gets into if your medical bill was sent to collections, what should you do? This section of the guide walks people through what happens, what to ask your debt collector, how it might impact your credit score, and how to file a complaint as well. So an important thing is to definitely check your credit score, as mentioned. There's different sources where you can check your credit report. The one that's recommended in the guide is called annualcreditreport.com. You can also call the number listed and they'll be able to provide you your credit report free of charge. So make sure that you do not pay for your credit report, because that there are definitely resources that should be providing it to you for free. So there's a section on the credit report where you can check if you have anything collections, if you have any new debt that's reported on there that's not expected. And the following types of medical debt should not be listed on your report. So if you have any paid medical bills, let's say you got a service and you already paid it, but the hospital just didn't check it off on their end and they reported collection agency, of course, that should not be on your credit report. And if you have any unpaid medical bills, unless the bill has not been paid for 12 months. So if it's over a certain time frame, hospitals may be able to send it collections, but they have to provide you multiple notices. They have to give you time to apply, and they have to give you different options first. And then a newly or recently enacted law was that the CFPB, or the Consumer Financial Protection Bureau, proposed that medical bills $500 or less will not be reported in credit reports. And some states are actually doing even more. So some states like Colorado and New York, they are pushing for medical bills to not be included in credit reports at all. So I think that's the overview of the guide. I know that's pretty quick overview, but wanted to see if folks have any questions. You can also find the full report on the link in the chat.
Thanks, Jenny. Before I let folks jump in, I'll start you off with a few questions, and then we can let folks either unmute themselves or you can put your questions in the chat. I think, thank you for going over like an overview of what each guide offers. I really feel like I have to go read the guides very thoroughly myself. But I'm curious, I think one of the things that really stood out to me as you were going through this information was the usage of like paying a medical bill with your credit card. And I know from the work that I've done that I should avoid credit cards like Care Credit, for example, right? That have like really high interest rates once the interest rate kicks in. And usually that interest rate is applicable to like the initial charge that you put on the card. It's not based on like the percentage of the amount that you still owe. I know this from a personal experience. But I think the other thing that's coming up for me is I feel like I have heard a lot of messaging around like if you have a credit card from your bank, to pay for things with your bank credit card, because usually you have more protections compared to for like fraud, for example, compared to like paying with your debit card, right? So like, and like it's easier to get reimbursed if like there's some like issue with like payment, etc., with a credit card versus your debit card. So how are you managing? Oh wait, did Jenny freeze? Oh no. Did we lose Jenny? I think we lost Jenny.
Yeah, I think the connection.
Oh no. Everyone's having internet issues.
Yeah, because it's raining and storming, so yeah, the issue tonight.
Second. But does anyone else have other questions?
I think one of the things I wanted to ask her is how do they actually let people know that these booklets exist, you know, that she was talking about for the information and stuff. How do they get that information? How is it done in layman terms? So if I come to the hospital, how would I know that? How am I going to understand when I have no idea, you know, how this whole thing works?
Yeah. Great
That was
question.
my question.
Sorry, my internet cut out.
It's okay. I don't know how much you heard from my question, but we have another question too.
Okay, great. Sorry about that.
No, don't be sorry. We get it. So I was essentially saying like, how do you balance between like the conflicting messaging from like banks around credit card usage and like more protections, and then like the actuality of what it means to pay for medical bills specifically with a credit card, especially if a credit card is like the only like immediate source of like available money that somebody might have. So that was my question. And then there's also a question around communicating some of the stuff that you shared in layman's terms that I will pass off to Reverend Anderson afterwards.
Yeah, I mean, I think with medical credit cards, people tend to see that as a quick option to get rid of or to essentially remove the debt temporarily, right, from their mind. But I think the best option for folks is to definitely look into different resources. I mean, hospitals are actually obligated to provide financial assistance or charity care. So it's very important to ask about what your options are. A lot of people sign up for credit cards because they're advertised as like low or no interest. And it's actually something that our partners in Maine are actually working against as well, is to prevent this deceptive marketing of care credit or credit cards, because a lot of people fall into this trap of getting the credit cards and then ending up with really high interest.
Reverend Anderson, do you want to ask your question again? Oops, hold on, you're on mute.
Okay, can you hear me? Okay, great. So, hi Jenny, great presentation that you did on today. A lot of information that I had not even heard of myself, but I'm just thinking about it. I'm listening to it. I'm kind of following it. I'm kind of understanding it. but I could see where people would not. You know, and I guess my question was, in terms of even like the information, the booklets, and some of the things that you shared on today, how is that shared with persons, you know, that are seeking financial assistance or may need to seek financial assistance? And what lay terms is it put into? You know, also so that they can kind of have an understanding. A lot of times people don't maybe take advantage of things because they don't know about them at all.
Yeah, absolutely.
And
I would say
information's
that,
over their heads.
yeah, I mean, it goes over mine sometimes too. I would say that, you know, we rely a lot on our partner organizations, like Health Equity Solutions. I mean, different legal aid organizations are using this guide to help, you know, walk people step by step through this process. The organization I mentioned earlier too, $4, which I believe someone linked in the chat, they also have people who can walk people through, you know, understanding the bills, how to apply for financial assistance. The hospitals are supposed to be doing that as well. So it's definitely important to ask them first to see if you can get the resources, because they should be able to provide like layman's terms as well, like what each individual charge is, what these different terms mean. Um, some states also have what's called navigators or CHWs, community health workers. Um, these folks will also help people, you know, understand the process, walk through the application, and help people understand if they're eligible for certain resources.
Yeah. Now I've had CHWs also that you know have had to help people navigate it, and it was not easy. I mean, even for them to navigate it, to actually help people to navigate it. So I guess the question becomes, what are the hospitals doing, or either your partner organizations, what are they really doing to make this streamline the process and make it, you know, as easy as possible?
Yeah. Some states are pushing for a universal financial assistance application. So right now, each hospital can have their own, and they can ask whatever questions they want. But um, some states are advocating for a uniform one so that there's just one single application that's usually written by the state. The state can distribute it. That means that more people will hopefully be more informed. There's different agencies in the state that will be able to help people navigate as well and answer questions. That's definitely one strategy that we've seen. That's it's still very new, so we don't know exactly how effective it is right now.
Mm-hmm.
But that's definitely one strategy. I would say our partners are also working, you know, door knocking, canvassing, passing out flyers, doing webinars, such as this one, and really trying to do outreach to make sure that people understand their rights, know what to ask, and they're able to use resources like this.
Thank you.
I'm gonna throw it to Anna.
Oh, yes. Hi, thank you. I just wanted to say that, well, first I want to thank you guys. This is a great information session, very necessary for the community that's witnessing today. I just want to say that from my experience, I know that the hospitals are not offering financial discount applications as they should be. It's actually very discouraged and frowned upon, and the people that try to really push for it get a lot of pushback from the higher ups. And the small interest loans that I think you were mentioning before, Jenny, those loans get people into $400 or $500 monthly payments for like the next 5 years when there's an emergency in the family. So I don't think that we're anywhere near coming to a solution for that. And unfortunately, I was working for both hospitals when ACA happened. And prior to ACA, there was a lot of help for people in the community. And the hospitals were doing financial applications that would write almost the entire bill off, and they're no longer doing that. It's a big problem that needs to be looked at.
Mhm. Yeah, I definitely agree. It's an issue that we see all across the country. A lot of states are struggling with hospitals that say they're in financial distress and can't offer things like charity care, but it is a federal obligation. So what we're also trying to do as an organization is push the federal government to also take some action and to um, make sure that hospitals are accountable, because a lot of hospitals who are obligated to provide charity care, they're nonprofits too. So that means they don't pay taxes, state, local, federal taxes, and that money is essentially supposed to be so that the hospital can offer charity care.
Mm-hmm.
So what some states are doing too is they're looking at, is there a certain percentage that they can say that the hospital should fulfill each year. So in Oregon, for example, they set a minimum expectation so that hospitals have to give that amount of money every year. But I think it's definitely an issue that I think we're still trying to develop strategies for and encourage the federal government to take action and place fines, for example, if they're not providing transparent information about it.
So what happens when you do have insurance? You have a job and you have insurance that has an unattainable deductible. So you're basically walking around without insurance. So many of us are going through that. Me, myself, I have to reach every year. I have to go into medical debt for $6,800 before I activate my insurance. And this is a year where I don't even think it's going to happen. And I advocate and work in the community with many people that don't go to the doctor at all. Then those people get mistreated when they end up in the ER because the staff in the ER thinks that people just like not going to the doctor, and they just wait to have to go to the ER for, whatever it is that they're there for. It's another huge problem. So maybe if we are thinking about pushing the federal government, I think it should be illegal to have such a high deductible that you could never really reach every year unless, you're dying. That doesn't mean how did we get into a situation where it used to be certain kind of jobs that only had this high deductible. Not that it's okay. It's not okay by far in any way. But now it's your regular nonprofit organizations are having these insurances where you need to have a high deductible. It's everywhere now. I don't see where it isn't happening. So things are getting out of control more and more, and maybe together we can come up with, solutions to really push this issue, because it's grown a lot of different limbs. It's out of control.
Yeah, absolutely. I mean, high deductibles, high copays, it's pretty ridiculous that we're seeing this now. I think that has driven a lot more medical debt more recently too.
Mm-hmm.
And I think what some states are pushing for is to raise the eligibility of financial assistance. For example, right now a lot of states are cover financial assistance for, let's say, 200 or 250% federal poverty level, and they're pushing for 600%. So that would hopefully cover folks who have higher deductibles, meet certain income requirements. Because right now, I think the folks who are employed, most folks who are employed and have coverage are likely over 200% federal poverty level. So being able to get a larger group covered by financial assistance would definitely, hopefully, be helpful. But yeah, I agree. I think there's definitely should be more federal level pushes to make sure that high deductibles are not a thing.
Thank you, Anna, for your question and your comments. And I know some people agreed with you in the chat. I'm gonna throw it over to Taylor, but I will say that we will go over some potential advocacy opportunities for folks after Q&A. So I just want to preface that we will be touching on that shortly. Taylor, go ahead.
Thanks,
And
y'all.
Francisco, I'll go to you afterwards.
Thank you. Jenny, thanks again for being here with us and having this conversation, especially during Health Equity Week. I'm super grateful. One of the things that I think really kind of like popped up into my brain when you shared going over some of the different things and the experiences of potential bills or whatnot is this word I think around like illegal surprise bills, right? Which is a little scary to think about because I mean, as someone who has health insurance, for example, when I navigate the system in health literacy, right, it's really difficult, I think, to even navigate even with insurance or like whatever you think is going to pay. You don't really know. You're just like, here's my insurance card. At least for me, I have federal insurance through the military, and so I think a lot about like, how do I know what's an illegal surprise bill versus like what's just like an average bill that I don't really understand. Yeah, how do you know the difference? And like, is there a way to navigate or ask without just being like them just saying like, oh yeah, it's just a bill, part of your plan. Like that's often what I get, and I don't really get a lot of like other info besides whatever's on it.
Yeah, so the No Surprises Act covers these illegal surprise bills. So basically, it's primarily for emergency care. So if you go to an ER, you often don't get to choose which hospital you go to, and that hospital might not be within your insurance network. So you can, the provider should be charging your insurance, but the insurance should be accepting it as in-network, even if the doctor's out of network, so that you don't get that surprise bill. If you do get an out-of-network charge from that provider, then you can dispute it with the insurance company and say, hey, based on the No Surprises Act, I should be charged in-network prices. Same thing with with scheduled care. Like, let's say you have an appointment and use an example, if you have a broken arm and the doctor says, this is your estimate based on your insurance. And if the actual price, as I mentioned, is $400 or more over, that's an illegal surprise bill. So you can go through the process to bring that down to the estimate.
Awesome. Thanks, Jenny. I appreciate that.
Francisco.
Yes, thank you so much. In relation to the ACA, there used to be a clause called the insurance corridor, risk corridors, something like that, in which when the risk was changing, the federal government paid the money to compensate the insurance companies providing the ACA for it. The last moment, when they were to funding the government, I recall that Senator Marco Rubio introduced a clause in which closed all that and all the derivatives surrounding that. And then the things start to get out of control because the risks that the population start to age, start to increase. And that cost was passed to the consumers. And the things, well, is not in the same type of beneficial than before. If you don't have a tax credit for that, you are in trouble. That can be an opportunity to see. Voice is not very good today. To examine how to close that again to restore this type of risk adjustment that the federal government used to provide. That's what.
Oh, yeah, I'm sorry, I'm not sure if I captured your question.
Yeah, the question is if there's some way to restore these risk corridors so the federal government can actually provide to the insurance company for a way to adjust the monetary cost of the risk. That was part of the thing that things are getting out of control. That was closing at the very last minute when they were about to fund the government again. Happened almost like 8.5 years ago.
Yeah, I mean, so the federal government does provide funding to hospitals so that they can also provide financial assistance to people. And it goes through a very complicated process. Like the federal government gives funding to the state gives funding to the hospitals so that they can provide free care to people who are eligible or do not have insurance. I think that's definitely something that's not as transparent or easily understandable, which I think it should be. I mean, I think the public should be aware of how much money the hospitals get from the different government agencies to help supplement financial assistance costs. But yeah, I think the government is funding funding hospitals to provide this kind of care. It's just that it's not as easily transparent with the public, I would say. And that's something that I think we should continue pushing the federal government to do is to make sure that these different funding sources and what the hospital receives to provide this kind of care is more transparent.
Thank you, Jenny. Latoya, I see your hand is up. Or I don't know if oh, Latoya, go ahead.
Thank you. Good evening. I think I have a couple of questions because I think it's going to depend on how you respond on whether or not I'm going to have subsequent. My first one is, so as we are discussing the providers, are we talking solely about providers that work through the hospital part of the care system, or are we also discussing primary care providers and private providers?
I think it depends on the situation. So if you're, let's say you go for emergency care, it would the protections do cover all the providers you see that you would need in an emergency situation. We have seen folks who have scheduled care that see a provider that's contracted by the hospital. So even though they are within the hospital or working within the hospital, some hospitals are saying that specific provider is not covered under our financial assistance policy, which I think is ridiculous. But that's something that we've definitely heard from other state partners, and still trying to think about, what are some of the solutions. A lot of hospitals who do this kind of thing, they are supposed to provide a list of covered providers, but of course people often don't really think to ask that first, right? I think that's something that I think hospitals should be more transparent about upfront.
Okay, so then that leads me to my second question, which is, I think I know the answer to this, but I just want to be certain. When you're talking about providers giving an estimate of what a procedure or what have you could potentially be, I'm presuming that has to be something that has been given to me in writing, that is not just like a verbal, communications. Like they have to actually say, give me something that's like maybe itemized out with like, this is how much it's going to be for your anesthesia and for the actual procedure and ... Like, is that what we're talking about?
Correct. Yeah. So
Okay.
I think you'll receive a copy of the slides, but in the slides, one of the slides gives an example of like a real example. Someone received an estimate by email, so they could use that email and they could use the actual bill that they received to file a dispute.
Okay, thank you.
Sonia?
Sorry. So I had one question is that, like follow what Ms. Latoya mentioned, is that we know that when we go to the emergency room, and especially when you are on insurance, more of them, like, they register right away and they take you to the room, and then they come a person that, I don't know if it's like the person in charge of billing or like, registration, that come with a computer and say, hi, my name is this, and I just want to confirm information about your name, address, and I want you to sign here, sign there, sign here. Oh, this is just a document for that they can get the treatment, or this is like, to share your record, but they never mention to you that you are signing one paper that is saying that you don't have insurance and you are responsible for the bill. So like follow what she mentioned is that is any way that like the prices or like the application can be filled up ahead or before, like, I don't know if it is possible or exists, is that you fill it up the application, it can be, good for a year in case if you go to the emergency or not, because that's one thing that they are not sharing with the community, that those resources exist. And also like for the proceedings or like the prices when they get the treatment, but after you get the treatment, they give you like, oh, you need to follow a referral or things like that, but you're not able to continue because you don't have insurance, you're not going to be able to pay. And then if you spend a week there, you receive the bill, so it doesn't kill you the sickness or like the chronic condition, will kill you the bill that it will receive. So it's really hard for you to decide. But if my question is that, do you know if it exists any, I know that sometimes they mention about the master charge. Is that exist on the hospitals too?
Yeah, so hospitals are supposed to provide a list of the charges that they for the most common services on the website. A lot of hospitals do not do that, though, unfortunately. Some states also have what's called an all payers claims database. So you can see how much insurance companies are paying for certain procedures. That way you can try to negotiate a cash price based on how much they're getting from different insurance companies. I think with the emergency room situation, yeah, I think it's ridiculous that, providers try to pressure you to sign these papers. And it's, like I mentioned earlier in the presentation, like signing a waiver to that you have to pay out of network prices, for example, that's illegal. But of course, people, aren't aware of their rights, and it's I think unfortunately it does happen where people do sign and then end up paying enormous prices that they shouldn't have in the first place. I think with the next part you mentioned about, if there's something that can say that you're eligible for a year or so, like some hospitals do have that kind of process where you can apply for financial assistance, and they'll keep your application and say that the services you get at that hospital will be billed to financial assistance first. But then after a year, you have to re-verify or reapply, for example.
If I may say one thing, I think we should all walk away knowing there is no charity app being offered to folks anymore. There is no such thing as a charity application. It's a serious issue. That's why this lady Sonia is saying that the community doesn't know this exists. It went away with ACA, sadly, not immediately, slowly but surely, the charity applications disappeared. So hospitals are not offering a charity application, and hospitals are under the obligation and to have this benefit for the community, and they also have community money every year. based on their tax bracket, whether they pay taxes or not, and that money is supposed to be used to give back to the community. Recently, I've seen how this money is being thought of like, you know, different ways to invest in the community, but why not right inside your hospital where people are walking away with a huge debt and the inability to follow up with care?
Yeah,
So,
absolutely. I think that's a good segue to the advocacy um, strategies that Health Equity Solutions, I think, is working on.
yes, that's exactly what I was gonna say. But I do want to ask one question, Jenny, before we wrap up this section. Thank you everyone for your questions, for your comments. I really appreciated them. Jenny, you reviewed a lot. I think one of the things that's coming up for me, because I know several of us work in other coalition spaces, including like the Husky for Immigrants campaign, where we work directly with diverse immigrant communities. I know Make the Road also works directly with immigrants. And one of the things that's coming up for me is in all of these guides, all the rights that are being overviewed, are they applicable for everyone regardless of their immigration status, regardless of their income? Is this truly something that like anybody can use? Or are there certain like limitations that we should be aware of?
It is open to anybody regardless of immigration status. So hospitals should not be asking, you know, for immigration status, social security number, citizenship, etc. For example, the No Surprises Act and the complaint process, like those are confidential, and those are explicitly stated that they do not share information with outside sources.
Thank you. Yeah, thank you, Jenny, for being here with us today, for answering all of our questions, for sharing with us what other folks are doing in other states. At this time, you know, I would, Katia, if you could share the slides again, please. I would love to take this opportunity to invite all of you to join us in some local advocacy efforts here in Connecticut, because we hear you, right? We agree with you that not enough is being done to protect people from medical debt, not only at the federal level, but also at the state level. So can you go to the next slide, please? So we have a few action items that I wanted to share with everyone today. But first and foremost, I think most folks are familiar with the fact that the Health Equity for the People by the People Coalition and Health Equity Solutions have been working on HB 5320, an act concerning hospital financial assistance. And this bill would do three key things here in the state of Connecticut to make sure that awareness about financial assistance at hospitals is improved, and that the accessibility to these resources is also improved. So the first piece of this bill would be the creation of a common application that all Connecticut hospitals would accept. So no hospital in Connecticut would have to, you know, would ask for more documents or more information than another hospital that's in the town over, for example, but all the hospitals would be asking for the same information, the same documents, similar to like the FAFSA application that you use to apply for college. And then you select like which institutions you want to send it off to. The second piece to this is putting in place higher standards of how hospitals need to communicate their financial assistance programs with patients, and making sure that that communication is offered in different languages. And the third piece to this is requiring hospitals to report to the state who is applying for financial assistance, how many people are getting financial assistance, and then also sharing with the state like who is being sent to collections. So next slide, please. So that is HB 5320. We had a public hearing a little less than a month ago, and we had an amazing turnout from some of our partners who are here today, who shared their stories and why this bill is important to them. And the bill was voted out of the Public Health Committee favorably. So yay, that was great. We're really happy about it. We had a press conference yesterday, which included Senator Anwar, who is the Senate co-chair of the Public Health Committee, where he spoke very strongly in support to HB 5320. And we also had our bill co-sponsors, Representative Elliott and Representative Denning there, and a few other key legislators. But with that being said, we want to make sure that we can continue to drive up support from our legislators throughout the state. So our first call to action to all of you this evening is to please sign our petition. Thank you to Katia and to Carolina from the Husky for Immigrants campaign. They put together this coalition that calls on our legislators to support HB 5320 and make sure that hospital financial assistance policies are stronger here in the state. So you can scan the QR code here on the screen. Oh, I'm trying to click on the PowerPoint. But I will also put the link in the chat. And, I hope that folks will fill out the petition and then send it off to some friends. Oh, thank you, Katia. It's in the chat. So I'll give folks another minute before I go on to the next slide to pull up the petition. All righty. I see people clicking away. So next slide. Oh, you already went to the, thank you, Katia. So our second action, call to action for folks. Oh, you're pulling up the petition. Oh, okay. Oop. Okay. There you go. So our second call to action this evening is to ask folks to please call your legislator to co-sponsor the bill. The more co-sponsors we have, the stronger the support and the more likely that we can, put this on a priority list for legislators. And the more legislators care about this bill, the more likely it will be called up in the House and in the Senate, and we get it passed and signed by the governor and it becomes law, right? So we don't have a script to share with you all this evening, but all of you signed up on Zoom. So we will be following up after this call with a link to the recording for today's session, the PowerPoint. We will include a script to call your legislator in that, and the link to the petition that I just shared. Next slide, please. And other things I wanted to highlight this evening regarding other efforts to prevent medical debt here in Connecticut is SB 395. So the Human Services Committee can listen to a bill around prohibiting the reporting of medical debt to credit rating agencies. So for up to 1 year after you are billed. So this is really important because we know that right now bills that are $500 or less do not get reported to your credit score. But this bill is saying no matter the amount of the bill, it will not be reported for up to a year. And that gives folks in the state of Connecticut a lot more time to figure out how they can potentially dispute a bill that they think is potentially illegal. If you are reading the guide that Jenny went through with us today, or if you might have more time to apply for financial assistance. So I wanted to also highlight this as a potential bill of interest for folks. And if you're interested in getting more involved, I know Rose had to jump off early. She shared in the chat. but Rose is working closely on this bill, and I'm happy to connect you with Rose to get more involved. In the other hand, a state agency called the Office of Health Strategy also just released a report today. Around community benefits. Community benefits includes a lot of things. Sorry, let me go back. Hospital community benefits specifically, which I know Anna has alluded to in her comments. So community benefits includes a lot of things, and it also includes hospital financial assistance policies. So this report does go over some of the trends around financial assistance or charity care here in Connecticut and Connecticut hospitals. If you like to read, if you like to look at charts, definitely encourage folks to check out this report. The Office of the Healthcare Strategy has a public comment period until April 30th. So if you're looking at this report and you feel like something is missing in it, I definitely encourage folks to write a comment and to submit it and to let the Office of the Health Strategy know where you might see gaps, where you want to see data be fleshed out a little bit more, and make sure that your voice is heard with how this report is being put together for the state. And I think that is it in terms of actions. I would love to see in the chat if folks can commit whether you will be signing on to the petition, if you're going to send the petition to 3 friends, if you're going to reach out to your legislator. Just let us know how you want to continue to get involved. LaToya already done. Oh, for the petition. Ooh, thank you. And we will be in touch with you all to make sure that you can continue to be involved with us. Next slide, please. And with that being said, we are only less than halfway through Health Equity Week. We still have a full schedule with events. So thank you for joining us this evening. We hope that you'll join us for our webinars tomorrow. We have one at 10 a.m. That Taylor and Callie will be a part of. And then we have one at 12 noon with the Connecticut paid leave to talk about paid leave here in the state of Connecticut and being able to take time off to care for yourself or your family. And then on Thursday, we do have 2 in-person events in Hartford. We will have food at the events. So I hope that folks are able to join us in the Capitol building. We will put the registration link in the chat. So if you'd like to join us, if you register, you will get like the instructions for where to park, etc. And yeah, next slide, please. And with that, I just want to take a quick second to acknowledge our sponsors for Health Equity Week. Definitely could not have done this without their support. We have a lot of amazing events happening this week. So I just wanted to make sure that we were very briefly acknowledging them. Next slide. Oh, LaToya. Sorry, it's LaToya and Callie for the housing webinar tomorrow. And that is it. Thank you everyone for taking the time. I really appreciated everyone's questions. Folks are putting links in the chat for the other events. And if you have any remaining questions, you can always email me or Callie or Tanya, and we will send them along to Jenny so that she can answer them for you all. Yes, please check out our website for additional information on Health Equity Week. All righty. Thanks, everyone.
Thank you.
Thank you, Sonia. Bye, Francisco.
Thank you all.
Thank you. Thank you, everyone.
Bye. Good night.
Good night.
Thank you
Great
to our
work.
interpreters.
Yes, and thank you. Sorry.
Like you see how
Thank you, Vero. Thank you, Margot.